Well, for more on the Zika virus, we spoke to Dr. Peter Hotez, Dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston, Texas. We started by asking him about the concern for newborn babies diagnosed with microcephaly.
Well, we're just at the beginning of understanding the full extent of disease among babies born to mothers with Zika virus infection. Microcephaly is by far and away the worst manifestation, but we're now realizing there are more subtle morbidities, more subtle disease happening. So a recent paper that came out in the New England Journal of Medicine indicates that a very high percentage of babies are born with multiple birth defects. So this really is what I call the virus from hell. It's a virus that when it infects pregnant women, oftentimes they have no symptoms themselves, but then the virus slips through to the unborn fetus and can cause devastating birth defects. This is why we have to pay so much attention to this disease. Unlike other viruses that are transmitted by insects, this is the first one that we know that will cause such congenital birth defects.
We know that the U.S. spent around $120 million to combat this disease in the past year. How much more should we be spending? How much more attention should Zika be getting with our time and resources?
Well, unfortunately, the United States Congress really let us down this year in 2016. At the height of the Zika epidemic in the summer, Congress went on recess without appropriating any federal funds. So as a result, we've never been able to do active surveillance to actually determine how extensive Zika virus infection has been in the southern United States. We know about a small focus in South Florida and a small focus in South Texas, but I'm concerned that we've missed many different outbreaks in the United States, and we're not going to know for certain until next spring when microcephaly babies are born. So this was an example where we allowed the epidemic to continue without really taking all the measures that we could have to have stopped it. And I'm also concerned now that this is happening globally. For whatever reason, global economies are not willing to spend the money to prevent catastrophic epidemics like Zika, and we're going to pay down the line because it costs hundreds of thousands, maybe more, dollars to take care of a baby with microcephaly, not to mention the devastating social costs. So it's really important that the world government leaders realize that these are important things to spend money on to prevent these epidemics.
Tell us a little bit about Brazil's response and what we've learned from Brazil and how the rest of South America should be dealing with Zika.
Well, that's the sad part, is we really did not learn from the Brazilian experience. So Brazil was the first country to notice that there was an association between microcephaly and Zika virus infection. They noted it in the spring and summer of 2015, and they're the ones that sounded the alarm. Their scientists connected the dots and showed that Zika was associated with microcephaly. That should have been a warning that wherever we have Aedes aegypti, we could start seeing Zika outbreaks. And so we knew this is a virus that was going to come into Colombia, to Venezuela, to Central America, and to the Gulf Coast, Florida, and Texas, where we have the Aedes aegypti mosquito. So we, in that sense, based on the Brazilian experience, they had to learn it the hard way. But we could have learned from their experience, I think, to help stem the tide of this outbreak.
The timing really could not be worse for some of these South American countries, Venezuela, Brazil, dealing with economic crises. How will they combat it?
Well, you know, right now what we're seeing in Venezuela, for instance, is a humanitarian catastrophe. There's been an economic collapse due to the drop in oil prices and corruption and other factors. And so the government is unable to cope with their already present tropical diseases. They're having difficulty controlling malaria and Chagas disease and diseases like schistosomiasis. And now you have Zika coming through. You're absolutely right. It's happening at the worst time possible. But even in the United States, I am of the opinion we've not done everything we can to really look and see where this virus is happening. So I think, and this problem is not going to go away. We've been seeing this now for the past 3 or 4 years, this big uptick in transmission of vector-borne diseases transmitted by insects, snails, and other organisms, and therefore we're going to have to figure out a new way of doing business and figuring how we're going to finance these very important control measures. Because right now, we have nothing really to offer pregnant women who are concerned about getting Zika virus infection.
Quickly, let me ask you, how far away do you believe we are from a vaccine? You mentioned it earlier.
Well, I think that there's some good news in that testing for a Zika vaccine is now underway in some clinical trials. This is being done at the National Institutes of Health, through the National Institute of Allergy and Infectious Diseases. The bad news is that the clinical development of a Zika vaccine is going to take time, because it'll have to be shown that a Zika virus vaccine is safe for use in pregnancy or in women who think they might become pregnant. That's about the highest bar there is from a regulatory standpoint. So unfortunately, while we're making progress, I don't think we're going to have a Zika vaccine anytime soon. I don't think we're going to have a Zika vaccine in time when we can expect Zika to return to the Western Hemisphere, and starting now and moving into the summer months in North America. So we're still going to have a very rocky road in 2017.